Now, as a myeloma physician, I have seen the stark disparity in myeloma within the African American community and other communities. As an African American physician, this is both personal and professional for me. Hi everyone, Dr. Joseph Mikhael here, Chief Medical Officer of the International Myeloma Foundation. And we're going to turn the tables today where I'm not going to be the interviewer, but the interviewee. And I'm wonderfully joined by my dear friend and colleague, Sylvia D'Souza, who will be interviewing me in light of Black History Month. Because of Black History Month, we want to have an open and honest conversation about race and ethnicity and how it affects health in general and specifically multiple myeloma. Please subscribe to our YouTube channel. And of course, if you ever have questions, reach out to us at the IMF so that we can help you through your journey or those that you love's journey with multiple myeloma. So let's get started. Sylvia, I love the fact that you're the one now asking the questions. So let me turn it to you and fire away.
Yeah, thank you, Dr. Joe. I'm going to take full opportunity of this interview that we are having today, but let's get to the nitty-gritty. In this day and age, why is it that race and ethnicity plays such a huge role, in communities and in the care that they receive?
It's such an important topic, Sylvia. And sometimes, as I often say, these issues are personal, professional, and political. Let's take the political part out of it and let's look at really what the data shows us. And sadly, we know that race and ethnicity has a huge impact on our health in general, even independent of the specifics of multiple myeloma. We know that there are drivers of that disparity, whether it is systemic racism, the healthcare system, the key important social determinants of health. If someone lives where they can't have good access to water and food and nutrition, then it's going to affect their health in general. And we know that individuals of certain races and ethnicities have a greater risk of that than others. So that's why setting the table with that discussion is so utterly important. And then to take it even a deeper level, we know that multiple myeloma has even more dramatic disparity, in particular within the African American and Latino American populations, where we have historically seen, unfortunately, inferior outcomes in survival than with the rest of the population.
Thank you so much for sharing. Obviously, the International Myeloma Foundation, came up with the Empower initiative, and it has a vision. And the vision is to address these disparities and to bridge the gap. Can you speak a little bit about what are some of the things that the International Myeloma Foundation has put in place?
So the Empower program, something we've created, is of course a tremendous passion of mine. And to explain, it's M-Power, which is short form for myeloma power, but of course a play on words, as we desire to empower patients and their communities to change the course of myeloma. Because the current course of myeloma is unacceptable. If a Black man or a Black woman is diagnosed with myeloma today, they're expected to live half as long as the same aged white man or white woman. And we know that that is utterly unacceptable. And so we created the Empower program to improve those short and long-term outcomes of patients of African descent, but also, of course, of all patients. It's so important when we have this conversation to remind ourselves that we want the best for all patients, and leveling that disparity, providing true health equity, is ultimately the goal of the Empower program.
Yeah, thank you. I mean, it's been astonishing, to have this front row seat to see how the program and the initiative has really evolved over the last few years since its conception. There's a lot of work that still needs to be done, and I know the International Myeloma Foundation and the Empower initiative under your leadership is really taking it each day at a time and really building on it. Can you speak a little bit about going into those communities and really building the trust and empowering them about taking their healthcare into their own hands?
When we built the Empower program, we built it on three key pillars, and they all start with the letter E, which helps me remember them, but also I think is just so fundamental. And the first is community engagement. The second is primary care education. And the third is myeloma patient care enhancement. And that first pillar of engagement is really important, where we're not just reactively dealing with a disparity, but proactively trying to prevent that disparity. Too long in healthcare, we go to the doctor, we go to our healthcare facility when I'm sick. We don't think about going there when we're well to promote wellness, to promote education. And part of what we do in the Empower program is go out into the community to engage that community, to have them understand the impact that myeloma has and what they can do about it. Because we can do a lot about myeloma even before the diagnosis is made. And so we will partner with just about anybody and everybody to reach people in their community. And as you know, Sylvia, we've worked in churches, in fraternities, in sororities, in community settings, in barber shops. We'll go anywhere to raise awareness about multiple myeloma, to have people understand the impact in their community and what they can do to reduce that disparity.
Speaking about communities and partnership, and you brought up the fact about us being present in churches, I would like to hear from you, Dr. Joe. The church in most communities is a place of worship, is a place where people find sanctuary. What is it like to go into these churches and to share about the Empower program and to speak about multiple myeloma?
Well, first of all, it's a privilege because we know that these are places of trust. And they put their trust in us and in me to go into these places of worship and these very sacred places in many respects. But that is so important because there's been a history of mistrust. There's been a history where certain individuals and communities have unfortunately been marginalized and not been given their due. And so we look at this with excitement, but also with humility as we go in. And we want to have people understand that we are here for their benefit, for everyone's benefit. And that's been actually, I would argue, one of the most important pieces of Empower and what we try to share with others in healthcare and in all of our communities is that building that trust, which of course can't happen overnight. This lack of trust took hundreds of years, tragically, to build. And we want to repair it. We want to rebuild it. And we do it one step at a time. And so we engage these already trusted partners, pastors and leaders and others in the community and work with them so that they can appreciate the importance of this disease and what it has done to their community and what we can do to overcome it.
Yeah, that's really profound. And I have had, again, the front row seat, having gone to the Juneteenth events in New York and other places, Empower workshops, just to see the power, just to see the impact of the initiative, going into these communities, bringing people closer together, helping them see what it is, what is it that we're enabling them to do. I want to take a slight detour here, Dr. Joe. One of the other interesting projects and one of my favorites within the Empower initiative is your Medical Health Equity Scholars Program. What was the vision behind creating that program? And can you speak a little bit about how you see that growing?
Yeah, that's now you've touched a great nerve because I love to talk about this program. Part of that threefold project of Empower, the community engagement, the primary care education, and enhancing the care of patients, we know to enhance the care of patients, we need a diverse workforce. We need individuals in the care of myeloma patients who reflect that community. 14% of the population are African American like myself, and yet only 6% of us physicians are of African descent and only 3% in oncology. So it's not just a numbers game. It's not just saying that, a black myeloma patient needs a black myeloma physician. It's not that simple, but we need greater representation within the health force. And so part of what we've decided to do is create this medical student health scholars program. And what these medical students get to do is they get paired with a myeloma expert for 6 months to do a project in health disparities. Many of these students are from historical Black colleges and universities. And over the span of this 6 months, they learn more about myeloma, they learn more about health disparities from an expert in myeloma who's passionate about this issue. And then it comes to a culmination because we've done this project in partnership with the National Medical Association and their research arm, the Cobb Institute. We all meet at the annual meeting of the National Medical Association, where each of those students can present their projects as a poster together and build that sense of community and understanding so that others can also learn from it. So the long-term vision of this is both to help in the short term with these specific medical students. So of course, I hope they'll all become myeloma doctors, but no matter what they ultimately do in their professions, they're now sensitized to health disparities and the issues within multiple myeloma, but also will build a large alumni, if you will, of committed individuals who can communicate together and support each other through this journey.
Yeah, because you probably have about, 24 now alumni, and a new cohort is coming in this year. I'm very excited to meet them. One of the things that I really find very fascinating and also admire and respect about the International Myeloma Foundation, because of leadership like you, who come with this mindset and the approach that no one organization can really tackle any one problem on its own. It's very holistic, it's extremely collaborative, and the Empower initiative really leads the charge by this example, that you're partnering with churches, you're really going into those communities, enabling historically marginalized communities and the community physicians. So what do you think, would be your end goal? This is not a problem, as you said, Dr. Joe, that, was created a year ago. It's almost a couple of centuries now. Where do you see this evolving?
Well, I love the way that you commented that it has to be in partnership. When we look at the degree of the disparity and the drivers of that disparity, the only way this can be solved is multi-partnership from the lay public, from the medical community, from industry and the pharmaceutical community, as well as government and the communities that we touch. And so we believe that the IMF is uniquely positioned to help lead that force. We know that there are things that the IMF can't do, just like there are things that a company can't do or things that the government can't do. But together, we can accomplish so much more than we could individually. And ultimately, my nirvana, what I would love to see is the diagnosis of multiple myeloma be made more quickly, because that's part of the great disparity of myeloma. And two, that we have greater access to all the therapies that we have in myeloma. I mean, we talk all the time about how we've transformed myeloma from a disease where people live maybe 1 or 2 years now to living well over a decade and living so much better. We want everyone to be able to enjoy that quantity and quality of life. And to do so, we need to do this kind of partnership as we've described. But I really do believe that the impact that we will have is a more rapid diagnosis, especially when the diagnosis is delayed within the African American, Latino American populations, especially with confounding things like diabetes and access to primary care, and then ensuring that these great therapies that we have can be brought to the patient. And so I know that these are in some ways huge endeavors, and I like to think big, but if we don't think big, we won't deliver big. And I believe that we are already having an impact, and I think we will see an even greater impact as Empower continues to roll.
The fact that we have the engage, enable, and empower model weaved into anything and everything that we do at the IMF, led by the Empower initiative, is truly commendable. So thank you for your vision on that. You've also really brought along key partners from the communities. For example, you have your Empower Council, that has your patients, caregivers, your clinicians who all have a seat at the table. Their ideas, their vision, and what they collectively want to accomplish is something that you and the IMF and the Empower Initiative has kind of enabled. Can you speak a little bit about that, Dr. Joe?
Yeah, it builds on this concept of the need of collaboration together. And so our Empower Council guides a lot of our activities and gives us insight and input. We have various subparts of the council, like a group of patients that we meet with every quarter that give us insight and direction, but the council oversees it all. And you're right, that council is really quite a beautiful collaboration of patients and partners, clinicians, individuals from industry, even individuals from government as we collaborate with the Congressional Black Caucus and others. And so that kind of work together gives us bigger ideas, keeps us humble, keeps us focused on the work that we want to do, and really has set a stage for what we're doing in the future. As now the work of Empower in 2025 continues to expand and will now expand even more deliberately within the Latino American population, another population where myeloma is diagnosed at a younger age, where myeloma is diagnosed sadly later in the disease course, and where there has been reduced access to those critical therapies that we often speak of, that I always sometimes summarize with the letter T, triplets or 3 drug combinations, trials, clinical trials, transplants, and now our new therapies with CAR T. And so we want all 4 of those therapies that have changed myeloma to be accessible to all. And it is only through the collaborative efforts like the Empower Council that we can make that reality.
So Dr. Joe, Black History Month is really a story of resilience, of progress, and works that still needs to be done. Can you speak a little bit about, who and what are some of the programs and the Black medical pioneers, if you will, that have paved the path for us to be doing what we are doing today?
That's a great question, Sylvia, because we have been so inspired by the past and incredible Black leaders that we've seen in the medical community, in particular at the National Medical Association, who's a partner with us in Empower. This organization has now existed for over 120 years, when Black physicians, frankly, were not allowed into other medical organizations. We also see this regionally. We've worked with a similar group within the Charlotte region. And the inspiration cannot be understated. One of the individuals who inspired me the most was Dr. Edith Mitchell. She was an incredible physician, a female Black physician who truly shattered ceilings and did work that almost no one else could ever have done. She was on our board at the IMF, and sadly she's now passed away. But before she passed away, she and I sat together and created the medical student program. And part of the passion we carry into that program is really a tremendous tribute to Dr. Mitchell and what she's done. And as we think of that resilience, as we think of that history, it guides us to the future, to recognize that we must and we can overcome health disparities in multiple myeloma and in other diseases. And it's only with that kind of resilience and with the allies working together that we can do that.
It is pretty inspiring, and it is also very gratifying to work with you, Dr. Joe, on the Empower initiative, because in my short tenure at the IMF, I've quickly come to understand and learn that multiple myeloma really affects communities very disparately. And then when it affects communities of color and marginalized communities even more, because of lack of diagnosis, and their treatments and therapies are actually really pushed back because they're already starting from ground zero. And so enabling these communities to really understand what it means, for timely diagnosis and to get access to treatments is really very inspiring. And I really hope to support you and the IMF in your endeavors in this space.
Well, thank you so much, Sylvia. I mean, that's what our goal is. When we bring the message to churches and barbershops and communities, we bring a simple message. The message is, 1, this is the impact that myeloma has in your community. Number 2, this is what myeloma could do to you. So if you have back pain or bone pain that doesn't make sense, if you're fatigued way beyond the usual fatigue we experience, or if your doctor has ever told you that you have anemia or a low hemoglobin, you need to have a conversation about the potential of myeloma. And then number 3, we always want to tell people that the IMF is here for them. Whether it's themselves, someone they know, someone in their family, someone in their church, someone in their community, we want to help carry them through that journey. And it's been a privilege to be a part of it, and very excited to be a part of it.
Thank you, Dr. Joe.
Thank you so much, Sylvia, for joining me today and for turning the tables and being the interviewer. I've really enjoyed this and trust it'll be a help to those who are listening. And thank you for all who have been listening today. And if you're interested in this topic, please subscribe to our YouTube channel. Visit us at empower.myeloma.org, where you can learn more about the Empower Initiative and all the things we're doing, and find ways to help and support us as we go community by community. This is both a national movement and a community movement, because no two communities are the same. And we want to bring this message with clarity. We want to bring this message with passion and with love right across the country. Always feel free to reach out to us at the IMF. Any of our social media channels, you can call the info line. You can even use our chat bot, Milo, at the myeloma website, who will guide you through some of the questions that you may have, and use the hashtag AskTheIMF. We all need to work together to bring health equity as a reality in multiple myeloma, and we appreciate your help and support. Thanks very much.